Rosa, your student nurse from Our Lady of Fatima University. For today's video, I'll be performing bed bath. So bed bath is the cleansing of patient's body while they remain in bed. It helps maintain hygiene, promotes comfort, improves circulation, and allow assessment of the patient's skin condition. So the purpose of bed bath are: first, maintain cleanliness and personal hygiene; second, promote comfort and relaxation; third, stimulate circulation to the skin; fourth, to promote a sense of well-being; and fifth, to prevent and eliminate unpleasant body odors. So before we begin, we need to review the chart of the patient for any limitation of his or physical activity to prevent any injury or discomfort to our patient. Then gather all the necessary equipment and place it on the bedside table within each easy reach. Then perform hand hygiene and put on gloves or PPE if indicated to prevent the spread of microorganisms. Now we need to identify the patient to ensure the right patient receive the intervention and explain the procedure to promote reassurance and provide knowledge about the procedure and also the patient's participation. Sir, can I see your wristband, sir? What's your full name?
Senior Pitan.
And how about your date of birth?
November 27, 2006.
Okay, thank you. So sir, this procedure po will involve washing your hair, arms, chest, abdomen, legs, and then while maintaining your privacy and dignity, I will use warm water and clean wash clothes, and I will ensure that you are comfortable throughout the procedure. Can I proceed po, sir?
Yes.
Okay, thank you po. And then I will close the curtains for the patient's privacy. Then remove any devices and stockings from the lower extremities according to agency protocols. Then offer patients bedpan to promote comfort and to avoid interruption while doing bed bath. So sir, you need po bedpan for your urinary.
No.
Okay, thank you. Then remove gloves and perform hand hygiene. Then, we're gonna adjust the bed to a comfortable height. Then, put on gloves. Then, lower the side rail. You're gonna lower the side rail to the near of the patient. And then, assist the set to the side of bed where you will work. Then, have patient lie on his back. Then now we're gonna loosen the top and remove all except the top sheet. Then place the blanket over patients and then remove top sheet. So I'm gonna put the blanket first. And I'm going to remove the top sheet. Remove the top sheet. Then, if the linen reused, fold it and put it on the cling chair. Then place soiled linen in laundry bag. Then take care to prevent linen from coming into your clothes. Then remove the patient's gown and keep bath blanket in place. So if the patient has an IV line, remove first the other arm, remove gown from the other arm first, then lower the IV container and pass gown over the tubing on the container, and then rehang the container and check the drip rate. So first we're gonna remove on the other sleeve. Then get the IV. Here's the IV. And then lower it and pass through on the sleeve. And then check the IV drip. Then raise the side railings and then fill the basin with a sufficient amount of warm water. Add skincare if appropriate. So here's our basin. Then lower the side rail close to the patient when you're to the bedside to begin the bath. Then put another towel on his chest. Then grab some towel and wash it in the amount. Then fold the washcloth like a mitt on your hand. Then lay a towel across, just like this, on the chest and the top of the bath blanket. So with no cleansing soap on the wash hand, wipe first the one eye from the inner part of the eye, going to the nose out to the outer part, then rinse again before washing the other part of the eye. Then pat it dry. Wash again the towel. Then from the nose, going to the chin. And then going to the back of the ear. Then wash. Then do it again. Then pat dry. Then do it again to the other side. Then apply moisturizer to prevent skin dryness. Sir, do you need to put some moisturizer on your face? No? Okay, thank you. And then expose arm and place the towel lengthwise under it. So put some lengthwise on the towel. Get some towel, then expose this arm. Then lifting arm is necessary to access the axillary region. Rinse and dry and apply moisturizer. Going to the axillary. Then place folded towel on the bed next to the patient's hand and soak bath basin on it. Then soak the patient's hand in the basin. So here's the basin. Then soak the hand. Then wash the hands of the patient. And after that, pat it dry. So from the same procedure, repeat actions from the other side of the hand and arm. Then next, spread towel across the patient's chest. Lower bath blanket to patient's umbilical area. Sir, I will gonna bring this down. Then cover the lower part. And then clean the chest. And then pat it dry. Then Then keep chest cover with towel between the wash and rinse. Then pay attention to the folded skin under the breast. Then lower bath blanket to the perineal area. Place towel over the patient's chest. Wash, rinse if necessary, and dry abdomen. Carefully inspect any umbilical area and abdomen folds for stress. Then clean the abdomen and also the umbilical area. Check if there's any. Yes. Then pat it dry. Then return bath blanket to original position and expose only the legs and put towel under the legs. Wash, then rinse if necessary. Dry leg from ankle to knee and knee to groin. Apply moisturizer if needed. Some towel. Then pat it also the pit. Then pat it dry. Then next, also pay attention the areas between the toes, and then apply a moisturizer. Then repeat actions for the other leg and foot. Then you're gonna repeat. Then pat it dry. Make sure that the patient is covered with bath blanket. Change water and wash clothes if necessary. Then assist the patient to side lying position. Sir, can you side view? One, two, three. And now position the bath blanket and towel and expose only the back. And expose only the back. And the buttocks. And then we're gonna clean the back of the buttocks. And check the sacral area. Pat it dry. Then observe any redness of the skin breakdown in the sacral area or any part of the back. Then, sir, give patients a back rub or massage. Sir, do you need a back massage so that you feel comfortable?
No. Yes.
Next, give an moisturizer if needed. Then, raise the side rail, then refill the basin with the clean water. Discard wash clothes and towel and remove gloves and put on clean gloves. Then clean perineal area or set patient so that he or she can complete perineal self-care. If the patient is unable, lower the side rail and complete the perineal area. Apply skin barrier as indicated. Raise side rail, remove gloves and perform hand hygiene. Then help patient put on clean gloves and assist with the use of other personal toiletries such as deodorant and cosmetics. sir, I'm gonna help you to put on the deodorant. And I'm gonna put your down. First, put the IV, insert the IV in the sleeve. Then protect below with towel, groom's patient hair. So sir, next po, gonna shampoo your hair. And let's put some towel on the eye. So, shampoo na po your hair, sir. Then massage. Massage the scalp. Then dry the hair using towel. If there's any excess, wipe it and dry the face, also the ears. Okay, sir. Then for oral care, if the patient is unconscious, let the patient sit on the sitting position. And if the patient is unconscious, let the patient on the side. And then the face also in the side. That's sir. The patient. Use your toothbrush. Sir. And pat it right down. And position the patients on the comfortable position. And now remove get the top linen. Put it over the blanket. And then remove the towel over the top linen. Make sure that the patient is in the proper position and comfortable. So when finished, make sure the patient is comfortable, and then the side rails up and the bed in the lowest position. Then change bed linens if necessary, and dispose of soiled linens according to agency policy. Remove gloves and any PPE if used, and perform hand hygiene. And that's it for the bed bath. Thank you.